Now for the next heart issue, which we'll get to discuss, this is what is known as what? Coarctation of the aorta. Coarctation of the aorta. So once you hear coarctation, of course, you know that there's kind of like a bending. Yes, arc. Just put out arc. Okay, arc is like, yeah, it's like a bending. You know. So coarctation of the aorta. All right. So it's a heart defect where the aorta, that's the main artery that carries oxygenated blood from the left side of the heart, okay, is abnormally narrowed. Okay, so can you see narrowed? Yeah, that's a bending too. Yes, you understand. So it's narrowed. So understanding the location of the narrowing, so typically occurs just after the arteries that supply blood to the head and arms. Okay, impact: blood flow to the lower body is reduced, so your lower body, your lower limbs is the one suffering the most, while your upper limb is still chilling, you know. So associated conditions, you can have it alongside other heart issues like bicuspid valve issues, ventricular septal defect issues, or tunnel syndrome, you know. So you have it side by side with that. Then symptoms by age, of course, newborns will be much more affected. So they have a pale skin, okay, and their lower limb is weak, heart failure signs, rapid breathing, poor feeding. Then infants, okay, they have high blood pressures, you know, cold legs and feet, fatigue, you know, chest pains, cramps. So teens might actually have this issue but show lesser signs, right? Might have this issue but show lesser signs. So diagnosis, all those physical examination are trying to actually look at, you know, the pulses in the leg, trying to pick up the tiredness in the leg. The echocardiogram, MRI and CT angiography, cardiac catheterization. So treatment: prostaglandin infusions to keep the ductus arteriosus open in newborns, okay, only newborns. Then for the children and elderly population, you might actually want to do all those balloon angioplasties, you know, surgical repairs, you know, all those stent placements, okay, and so on and so forth.